Most people have heard of iron-deficiency anemia, but did you know that it is also possible to have too much iron in your body? Today, I'm going to be talking about how to tell if you have too much or too little iron in your body and how to treat it naturally. My name is Rachel. I'm a nurse practitioner who started holistic healing family practice to get to the root cause of disease and treat with safe and non-toxic methods. Let's talk first about iron deficiency. Iron deficiency anemia is the most common type of anemia worldwide. There are 4 major risk factors for anemia. One is eating a vegetarian or vegan diet. We will talk more about this in a moment. Second is due to blood loss, such as from a heavy period each month. The third risk factor is a parasitic infection, such as hookworms. And fourth is heavy metal toxicity, especially from lead. Maybe you have one or more of these risk factors. What are some of the signs that you may have iron deficiency? Some of the symptoms are chronic fatigue, shortness of breath, a pale complexion, restless leg syndrome, spoon-shaped nails, and something called pica, which is craving non-food items. The most common craving that I come across in practice is ice. So if you find yourself craving ice, you may have anemia. How is iron deficiency treated? The first step, as always, is to identify the cause of the iron deficiency. Is there any type of bleeding or a heavy menstrual flow that is causing you to lose more iron than you should? Are you eating a balanced diet and getting enough iron in your meals? Do you have heavy metal buildup or a parasitic infection? Conventional medicine will generally treat iron deficiency anemia with synthetic or man-made supplements. The most common iron supplements are ferrous sulfate and ferrous gluconate. The problem with these medications is that they do not provide the body with a form of iron that it can use. Also, synthetic iron pills do not contain all the cofactors that are necessary to help you absorb and use the iron properly. This leads to a buildup of iron and iron parts in the body. So what is the best way to treat iron deficiency? The best way to get iron is through food. There are 2 types of iron in food, heme and non-heme iron. Heme iron is found in meat, and non-heme iron is found in fruits, vegetables, and nuts. In order to prevent either iron deficiency or excess, it is important to eat a diet balanced in heme and non-heme iron. This is why I mentioned earlier that vegetarians and vegans are at risk for anemia. Here are some of the foods high in iron: beef, lamb, liver, and some types of seafood have the highest amount of heme iron, although there is also some in chicken, pork, and turkey. Some foods high in non-heme iron include beans, lentils, pumpkin seeds, blackstrap molasses, spinach or other dark leafy greens, eggs, and certain types of nuts. If you aren't able to get enough iron through your diet, you can take an iron supplement, but it should be a high-quality whole food vitamin that contains iron in a usable form with the cofactors you need. You can also treat iron deficiency with homeopathic remedies that help the body correct the imbalance naturally. Now, I mentioned earlier that we were also going to be talking about the problem of having too much iron in your body. This is actually a more common problem than people think. The reason for this is all the iron-fortified foods that we eat. Although the idea of iron-fortified food seems good, the problem is the same problem that we have with man-made iron. And that is, the iron is not in a usable form with the cofactors that your body needs. Foods that are often fortified with iron include flours, cereals, and bread products. So if you eat a diet high in processed foods and refined carbohydrates, then you likely have too much non-usable iron in your body. Too much iron in the body leads to inflammation and can put you at risk for heart disease. So what can you do about it? The good news is women who have their menstrual cycle each month have a natural method of releasing excess iron from the body. For men and postmenopausal women, an option is donating blood regularly or doing intermittent fasting. I hope this has been helpful. Remember that if you're worried about having too little or too much iron in your body, the best things you can do is eat a diet balanced in heme and non-heme iron, and avoid or limit iron-fortified foods and synthetic iron supplements.